Every year, millions of people die from diseases that don't make headlines. They aren't contagious, but they quietly shape our lives, our economies, and our future. We're talking about chronic diseases, also known as non-communicable diseases, NCDs, the silent epidemic affecting people in the United States and across the world. Chronic diseases are long-lasting health conditions that progress slowly and often require lifelong management. They include cardiovascular diseases like heart attack and stroke, cancer, chronic respiratory diseases like COPD and asthma, diabetes, and other long-term illnesses such as kidney disease and arthritis. According to the World Health Organization, WHO, these diseases are responsible for 74% of all global deaths. That's 41 million people every single year. In the United States, chronic diseases are the leading cause of death and disability. Here are some eye-opening facts from the Centers for Disease Control and Prevention, CDC. 6 in 10 adults in the US live with at least one chronic disease. 4 in 10 have 2 or more chronic conditions. The top 3 killers are heart disease, claiming about 695,000 lives each year, cancer, responsible for around 600,000 deaths annually. Diabetes contributes to nearly 100,000 deaths every year. These diseases cost the U.S. economy over $4.1 trillion annually in healthcare expenses and lost productivity. That's nearly 20% of the entire GDP. Obesity is one of the biggest drivers. In 2025, over 42% of American adults are considered obese, and that rate is still climbing. Now let's look beyond the US. Chronic diseases are a global crisis. According to WHO data, 41 million people die every year from NCDs. Of those deaths, 17.9 million are from cardiovascular diseases, 9.3 million from cancers, 4.1 million from chronic respiratory diseases, and 2 million from diabetes. Let's see how this looks region by region. Europe. Chronic diseases cause about 86% of all deaths in Europe. Cardiovascular diseases are still the #1 killer, though smoking-related illnesses are declining due to stricter regulations. Asia, India, and Southeast Asia. Rapid urbanization has changed diets and activity levels. In India, NCDs account for 63% of all deaths. China reports nearly 300 million people living with hypertension and over 140 million with diabetes. Africa, historically dominated by infectious diseases, but that's changing fast. By 2030, chronic diseases are expected to overtake infections as the main cause of death in Africa. Urban populations now face a rise in obesity, hypertension, and stroke. Latin America countries like Mexico and Brazil face double threats: infectious diseases and NCDs. In Mexico, 75% of adults are overweight, and diabetes is a national health emergency. So what's driving this rise? Experts point to 5 main risk factors: unhealthy diets, high in sugar, salt, and processed fats; physical inactivity, more desk jobs, less movement; tobacco use, still responsible for 8 million deaths each year globally; harmful alcohol use, contributing to cancers, heart disease, and liver problems; air pollution, a major but often overlooked cause of respiratory and heart diseases. Even mental health plays a role. Chronic stress and depression are linked to increased risk of cardiovascular disease and diabetes. The good news: up to 80% of premature heart disease, stroke, and type 2 diabetes can be prevented through lifestyle changes. Here's what works: eat real food, fruits, vegetables, whole grains, lean proteins, and healthy fats. Move more. Just 30 minutes of exercise daily reduces chronic disease risk. Avoid tobacco and limit alcohol. Get regular checkups. Early detection saves lives. Governments can help too, by adding sugar taxes, banning tobacco ads, improving air quality, and investing in public health campaigns. If we don't act, chronic diseases could cost the global economy $47 trillion by 2030. That's equivalent to wiping out the entire annual GDP of several developed nations combined. But there's hope. Global health initiatives like WHO's Global NCD Action Plan and the UN Sustainable Development Goal 3.4 aim to reduce premature deaths from chronic diseases by 1/3 by 2030. Chronic diseases may be silent, but our response doesn't have to be. Whether you're in the United States or anywhere in the world, the choices we make today will shape the health of tomorrow. Let's take action. Eat better, move more, live longer. If you found this video helpful, hit like, subscribe, and share to spread awareness. Because together, we can turn the tide against chronic diseases.